Thank you for joining me. We're nearing the 2-month mark in our fight against the 2019 novel coronavirus. And so far, the public health aspect has been our #1 priority because there is nothing more valuable than life. Now we're reaching a point where we can more fully address some of the economic effects of COVID-19. An estimated 1 in 6 Pennsylvanians who are currently able to work do not have a job. Some of these Pennsylvanians have been laid off due to a temporary closure and will soon resume working, but many others worked in a job that has permanently disappeared. As businesses begin to reopen, we're walking a tightrope between health and economy. Though the spread of COVID-19 has slowed, we have not eradicated this illness, nor have we cured it. We anticipate many months to pass before we have a vaccine, and some current projections show a resurgence of the virus in the fall. We do not want to spend the next few months or next year cloistered inside our homes. We want to be able to resume working, going to school, going to church, and visiting our loved ones. We want to reopen businesses of all types, and we want to be able to do this with as little risk as possible. When this virus first arrived, we had very little time and knowledge to prepare. Now we have the gift of experience. We have better testing capabilities. We have a more robust contact tracing system in place, and we have a better understanding of the virus's transmission. To reopen our economy to its maximum potential, we will need to boost our ability to contain this highly transmissible virus. So I am proposing the Commonwealth Civilian Coronavirus Corps, a new program that will expand our ability to conduct contact tracing and testing and mobilize Pennsylvanians to do all sorts of things to contain the COVID-19 virus. The Commonwealth Civilian Coronavirus Corps will reduce our unemployment rate while making a lasting health and economic contribution to our Commonwealth. By maximizing our testing and contact tracing capabilities, we can contain COVID-19 without widely freezing the movement of Pennsylvanians. If Pennsylvania protects its ability to produce and sell goods and services, our economy will regain lost momentum. The Commonwealth Civilian Coronavirus Corps will not be a replacement for everyday hygiene, wearing masks, social distancing, nor will it replace our health care and other workers who already play a vital role in contact tracing. We will likely still be unable to resume activities with large crowds such as concerts for fear of infecting an enormous number of Pennsylvanians at one time. But effective containment will allow us to resume life as much as possible. We have slowed this virus through shared sacrifices, and we have bought precious time. We need to now use that time effectively by building a program that will allow our Commonwealth to function as much as possible while we wait for a vaccine. And we need to regrow our economy. The Commonwealth Civilian Coronavirus Corps is my plan to do this, and I will continue to unveil aspects of this plan in the coming weeks. In the meantime, thank you for your patience and thank you for your continued support as Pennsylvania continues to work together to get through this crisis. Now, before I turn this over to Secretary Levine, I'd like to extend a special thank you to community health nurses in honor of World Nurses Day. As we reopen our Commonwealth, we will increasingly rely on community health nurses who form the backbone of our contact tracing program. Community health nurses have always been essential to the health and well-being of Pennsylvanians, and now they're even more important, and they deserve the gratitude from all of us. So, on that note, I'm going to turn it over to Secretary Levine now for her daily update. Secretary Levine.
Good afternoon. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 888 new cases of COVID-19. This brings our statewide total to 51,845 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. This includes 3,316 positive cases in healthcare workers. It includes 2,062 positive cases in workers within the food industry at 122 facilities statewide. And it includes 10,010 positive cases among residents of 502 long-term care living facilities, which include nursing homes and personal care homes. Tragically, we now have 3,106 patients who have passed away, who have tested positive for COVID-19. To date, all of our deaths have been in adult patients. As of 10 a.m. today, hospitals are reporting that approximately 2,553 patients are currently hospitalized due to COVID-19. 549 of those patients are currently requiring the use of a ventilator or a breathing machine. Across our healthcare system, approximately 46% of hospital beds, 40% of intensive care unit beds, and nearly 75% of our ventilators are still available. As the governor pointed out, this is Nurses Week and National and International Nurses Day today. Across the nation and across Pennsylvania, we want to take a moment to recognize the essential contributions and sacrifices that nurses have made throughout this pandemic. This includes nurses caring for patients with COVID-19 and caring for other patients. All of our nurses, including those here at the Department of Health, have been instrumental in caring for the citizens of Pennsylvania. At the Department of Health, our nurses have been on the front lines, from helping nursing homes to do contact tracing and getting people connected to care. I want to thank them for working in communities across the Commonwealth to help us achieve a healthy Pennsylvania for all. But we wanted you to hear about their work in their own words, and so we have this video.
Hello, my name is Lisa Snyder.
Gene Simons, Jim Hamilton,
Anita Fulkerson.
I'm a population health nurse.
I'm a community health nurse supervisor.
And I'm a clerk typist.
I'm a community health nurse.
I'm the district nurse administrator.
And I work in
Schuylkill County.
In Westmoreland County.
Mercer County.
I have been with the Department of Health
For 15 years.
for 6 months.
For 30 years.
For the past 4 years.
29 years and 10 months. If public health is working and we're doing our job, the public doesn't know anything's going on.
We're always working in the background, also doing surveillance, preventing infectious disease outbreaks.
It's the best kept secret in the state. We are in every dimension and organization, and we know how to get things done.
We are here to protect the public against communicable diseases, vaccine-preventable illnesses, and to make your community a great and healthy one.
We offer free immunizations to uninsured and uninsured people.
Everyone is eligible. The community becomes our patient.
Public health nursing means fun. You're working with a great group of colleagues. You get to collaborate together, as well as being able to share a partnership with the community members that you're serving and make a difference in their lives.
Educate, inform, and empower people to make good health choices.
As a nurse, we keep our pulse on the health and well-being of our community.
caring for individuals in order to affect the greater good.
It means power, power to assess needs, power to educate.
Commitment. You commit to being there for your community.
Thank you again to every nurse in Pennsylvania and our nation for helping keeping us safe. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice, and use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands, And don't touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go out for life-sustaining activities, please wear a mask if you're going to come into contact with others. If you have questions about your health, please contact your healthcare provider. And if you need mental health resources because you or someone you know is experiencing a mental health crisis, please use our crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. If you or someone you know is suffering from an addiction, you can call the helpline through the Department of Drug and Alcohol Programs at 1-800-662-HELP. Again, 1-800-662-HELP. For the most reliable information related to Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And the Governor and I will now take your questions.
Thank you, Secretary. Our first question is for you from WHYY. Last week, New Jersey released its provisional death statistics for the past few months, which show a clear rise in deaths. Could you comment as to why Pennsylvania has not recorded a similar rise in deaths? Is it because the impact of COVID has been limited here or because of reporting issues on the state side?
Well, first, New Jersey has a completely death reporting system that we do. We have great coroners, 67 coroners in our Commonwealth. They have a medical examiner system that reports through their department, so it's a completely different system. But we've been looking at the data today, and in New Jersey, they have reported 131,890 patients with COVID-19. They have reported 8,549 deaths, which is approximately 6% of patients have tragically passed away. In Pennsylvania today, we reported 51,845 patients with COVID-19, and tragically we have reported 3,106 deaths. This is approximately 6% of patients with COVID-19 have tragically passed away. So in terms of the death reporting due to COVID-19, it's approximately the same.
The Public Source and Post-Gazette also have questions on death reporting. The New York Times reporting this morning that the state's reporting of death totals to the CDC was slower than normal. Why is that, and why is it problematic this year?
Well, so reporting all the deaths and the cases and deaths of COVID-19 has certainly been a challenge in our department to do that in real time almost and to reporting that data every day. In terms of death reporting, we have our two death reporting systems that I have discussed, the NEDS reporting system, but also our electronic death reporting system. We get deaths recorded from our great coroners as well. And then we get deaths reported through our systems through the county municipal health departments. We have mentioned that Philadelphia has a different system, and it has taken time to reconcile that. So has been a real challenge. We are absolutely committed to this, and the governor has emphasized this, his commitment to getting this data out in an efficient way. We are going to be working every day now to reconcile our data with the Philadelphia County Health Department. We are working on both personnel and in IT ways to harmonize and reconcile our NEDS system and our electronic death reporting system, and we commit to getting the most accurate data reported to you every day that we possibly can.
From 6ABC, the Butler Eagle, and WKOK, questions about elective surgeries and dental guidance. There seems to be some confusion when dental practices can open for elective procedures, including routine teeth cleanings. In what phase are you advising dental procedures to open for elective non-emergency care?
We'll be having dental guidance that will be released by Friday.
And then also a local dentist expressed his concern about a hospital resuming elective procedures, not receiving PPE from the department. This dentist says local doctors should be making the decision as to whether or not a procedure is necessary or not. What is your response?
Well, we agree that local doctors should be making the decisions whether a medical procedure is necessary, and we agree with that. And in almost all the areas of the state, except for the hardest hit areas, we are allowing elective procedures to start in hospitals and health systems, as well as ambulatory surgical facilities. The question of personal protective equipment is different, however. We have to prioritize the state's supply of personal protective equipment that we have gotten from the federal government, as well as really purchasing that throughout the state and the nation and internationally to the areas most hard hit from COVID-19. And so right now, we are prioritizing long-term care living facilities, including nursing homes and personal care homes that are struggling with patients with COVID-19.
From Fox 56, what exactly are respirator decontamination systems and how can they help our first responders?
Mm-hmm. Well, the Battelle unit has opened in Delaware County. This is a critical care decontamination system. It's very important to emphasize this is free. And this is used to sterilize the N95 masks that we have been talking about. Those are called respirators at times. That's different than a ventilator. But these N95 respirators can be sterilized using aerosolized hydrogen peroxide, and that is being done free for hospitals, health systems, first responders, nursing homes throughout the Southeast now.
Thank you, Secretary. Our next question is for the Governor. Governor, from Spotlight, PA, what is the timeline for hiring the Coronavirus Corps, and how many people are you going to hire?
I'll be giving more details as we move out. At this point, we don't know, but to have an impact on the economy, we want this to be a big deal. Again, the point of this is to create a corps of trained folks who are ready and able, have the skills we need them to have to help usher us all through the new environment that we're going to be facing as we get into this post-pandemic world.
Also from Spotlight, PA, how will the state pay for this through federal CARES dollars, and when will you be able to detail how the dollars are being spent?
The hope is that we can get special funding from the federal government for this. That's what we're trying to do at this point. Again, as this unfolds, we will produce, as we know more details, we'll be sharing those details.
Do you need legislative approval for the Coronavirus Corps?
At this point, no. I have shared it with legislative leaders, in fact, just today, and explained how we're going to be funding this. And I think they agreed that at this point there's no need for legislative approval for this.
From WNEP, a photo making the rounds on social media shows a Senate staffer giving haircuts to lawmakers outside the Capitol. The photo has prompted a lot of comments claiming the hypocrisy since professional barbershops and hair salons are not ready to open yet. What is your reaction?
Yeah, I'm not familiar with this. I wasn't, obviously I did not get a haircut, but I think that question would be best directed to whichever Senate staffer actually did that.
From ABC 27, earlier this week, a state representative suggested your administration's lack of transparency reminded him of how Nazis or Soviet Russia conducted business. What is your reaction to that remark? And as a follow-up, he's not the only Republican lawmaker suggesting that your administration is not transparent in the specific criteria for reopening counties, and lawmakers say you have not engaged with the legislature. What is your response?
Well, there are about three questions. I have actually worked with the legislature. As I said, every week we have meetings with the legislative leaders. We're continuously meeting through the Legislative Affairs Department, I think 7 days a week with the legislature. Our Intergovernmental Affairs Division is meeting and working with local governments every day, all the time. So I'm not sure that where we're not doing that. If there's a place that we should be working more closely with anybody, I'm open to that. In terms of transparency, I absolutely want to be transparent. If there are some areas where we could do a better job there, and I understand that we're trying to fight this disease, but there is no excuse for not being as transparent as we possibly can, and without violating whatever confidentiality rules. So I want to be as transparent as I possibly can, and I think we've done everything we can. If there's something I'm missing, I'm always open for suggestions.
From Bloomberg News, how does the Northeast Coalition operate? Weekly calls with governors, Zoom meetings, something else?
We have occasional Zoom meetings. We just had one on Sunday. But the routine is that the senior staff members meet at least twice a week, sometimes more often, to go over things that are going on in each of our states. Most recently, I think we announced publicly that we're working to pool the buying power of the 7 states to form a consortium to make sure we're doing everything we can to get the PPE, the equipment material we need to fight this virus. Also working with the institutions of higher education, research institutions to do more than we've done in the past to actually engage them to do research. And with, especially in Pennsylvania, our manufacturing base, we want to make sure that we're doing everything we can to make the stuff we need. Again, by combining all 7 states, we have more buying power, more brain power to do the things we need to do to fight this virus.
From WNEP, we've received calls from several viewers concerned about plans by a bus company to resume service from Northeast Pennsylvania to Philadelphia and New York City on Monday. The company says it plans to limit the number of passengers and take only essential workers. Considering that neither Northeast PA, the Philly area, or New York City has reopened, do you believe resuming this bus service now is a good idea?
From what you said, no, I don't.
And then from Fox 56, in terms of the decontamination systems, that you announced a program to give free decontamination systems for first responders and healthcare facilities. Why did you decide to do that?
Well, protective equipment, I mean, including decontamination equipment. The idea is that these folks are on the front lines of the fight against the coronavirus, and they're the ones that we really need to make sure are as protected as they could possibly be. And that's pure and simple what is driving that.
Governor, from NBC 10, what have the discussions been with your administration about granting long-term care facilities civil immunity during COVID-19, and are you going to give them that immunity?
In terms of the facilities, no. We have been in conversations about making sure that healthcare professionals, especially those who are coming back specifically with the single intent of fighting this disease and being on the front lines, we have been talking about trying to give them some additional liability protection, and I think there'll be an announcement today on that.
Governor, from the Associated Press and WNEP, some businesses are opening in defiance of your shutdown order. What is your reaction to that? Are you worried that the dam is starting to break and you will see a lot more businesses reopen when they're not supposed to?
Yeah, I think there's a natural dam here, and it's not the government. I mean, we have the orders and guidelines in place, but really, to the extent they are ignored, is going to be a bad thing for the businesses. Because if a business opens and they haven't done the things, or we're not ready to reopen, I think they're going to have trouble inspiring confidence in their customers or their employees. And so I think there's a natural restraint here, a natural constraint on businesses making random decisions to open ahead of their customers or their employees.
Our next question is for the Secretary. Secretary, from the Pittsburgh Post-Gazette, the second part of the question that I had missed earlier on reporting deaths. Has the state taken a look at the overall death totals to try to come up with some estimate of the excess death total so far this year that might demonstrate the full impact of the pandemic?
Well, I mean, we certainly know that there are over 3,000 deaths specifically from COVID-19, but I'm aware of some of the calculations that the question is referring to, and we'll be taking a look at that.
From WFMZ, regarding nursing homes and including them in the count to reopen, at least one county, Delaware, has asked that these positive cases be excluded, and some others, Bucks, has alluded to this. Is there any way to do this and reopen safely, and why not exclude them if the majority of cases are in nursing homes?
Well, the majority of the cases in many counties is not in nursing homes. The majority of the deaths are in nursing homes, but not because of the age of patients in nursing homes and the amount of medical conditions and comorbidities that those individuals have. But the majority of patients from most counties are not in the nursing home, but they are really part of the community. Nursing homes, perhaps food manufacturing and distribution centers, county and state prisons are really part of a county. They are part of the community. The workers that work in county and state prisons are part of the community. The workers and staff that work in nursing homes and personal care homes are part of the community, as well as those that work in those type of plants. And so that really is part of the mix of a community, and the cases that are in those facilities are part of the communities and the counties count.
From ABC 27, what is the administration's response to a state lawmaker encouraging people not to wear masks whenever they go into an establishment, saying it does nothing unless you're in close quarters?
Well, I think that that is incorrect. I think that on the recommendations of the CDC and the federal government, as well as many other countries and really every state in the country, we are recommending that individuals wear masks if they're going outside and they're going to encounter people. As I've said many times, my mask protects you and your mask protects me. And if we're all wearing masks, then the community itself is protected, and there's a decreasing rate of the spread of this very infectious and communicable disease, COVID-19.
From the Tribune Democrat, reporters saying that they were contacted by a reader whose parents had positive antibody tests and blood work from a hospital stay in December reevaluated. It showed strong indicators for COVID in the December blood work, and it said that the reader contacted the department and even told them they would be counted in Cambria County's report. Would they be among confirmed cases reported each day or probable cases that are not included? And would their situation affect the county's incidence rate? I'm
not aware of the official report, and so I'll have to check with our staff about that. It's very interesting if they had antibodies from an illness in December. In December, the only reported cases were in China, and so that would be very interesting data in terms of possibly how early this disease was showing up in other countries. So I'll have to check in terms of the exact report to the state.
From the Post-Gazette, what role will technology play in Pennsylvania's contact tracing effort, and how do you balance it with protecting people's privacy?
Well, we will be using technology. We have talked about a product called Sarah Alert from MITRE, which will be helping us in terms of that. We're also in discussions with some other technology companies about using apps. Using the apps that would track people's whereabouts on cell phones would be voluntary. So it would be an app that you would download to your phone, and other states are starting to use this now, and we're having discussions about how we're going to make the app for Pennsylvania. And so that would be voluntary, however, to participate in that type of program.
From the Altoona Mirror, UPMC's Stephen Shapiro said today during a Senate hearing convened by Pat Toomey that reopening coupled with continued protective cloistering of vulnerable populations as in nursing homes was a workable strategy. Do you have any comments?
Well, so as with the governor's phased reopening program, we are looking at different counties. We're looking at the metrics that we have described before, as well as the modeling from Carnegie Mellon University and other models that we have explored, as well as those quantitative measures and other qualitative measures in terms of which counties will go from red to yellow. We feel that as we concentrate in terms of our testing and our contact tracing in those counties and those areas, as well as concentrating on long-term care living facilities, that we will be able to prevent the spread and further outbreaks of COVID-19.
Our next question is for the governor. Governor, from Penn Capital Star, why has testing plateaued? The state collected an average of 5,900 new tests each day over the last week, and that figure falls short of its goal of testing 8,500 people per day. Looking over the past month, it's clear that testing data is now lower. State officials have said all along that capacity is increasing. Why should we believe that now?
Yeah, and I'll let Secretary Levine take this, but let me just start saying one of the things is that we limit the number of people who actually qualify to take the test, because we say you have to have a medical professional send you to get the test, which means you have to have some indication that you may have the disease. As fewer people have this disease, there are going to be fewer tests unless we change the rules. So until we get to the point where we can do mass testing, surveillance testing, I think this is something that we're going to see. So I think that might be, and I'll let the Secretary chime in here, but I think that could be something that's a function of a disease that we're actually starting to beat. Secretary Levine.
Thank you. Well, certainly I agree with the governor in terms of that we are seeing less cases of COVID-19. We reported 888, I believe, new cases, and so that's really good news. We're going to have to, that's over 4 days now that we've had less than 1,000 new cases. Trends mean more than any specific day, but it's starting to form a trend, so I think that that's very positive news. But we do want to continue to expand testing, particularly in the areas that are still affected in the southeast and the northeast, where there's still significant incidence of COVID-19, and into those areas that are going yellow in 2 days now. So we're going to be working to do that. As the governor said, except for our mass testing sites, you need a doctor's order to have a test done, and we're trying to think of some ways that we might be able to make that even easier for people to get tests. We want tests to be done at hospitals and health systems. We know that Rite Aid is doing tests, and we're trying to expand that as well, perhaps other types of pharmacies. And then we're going to start to consider when and how we would do the type of population-based testing, which is very different, the type of surveillance testing, and when we'll be able to do that. So we're going to take all of that into consideration, and we still want to increase testing.
Thank you, Secretary. For the reporters whose questions we were not able to get to today, the Department of Health and the Governor's Office will respond within the next 24 hours. Our next briefing will be tomorrow. Thank you.